Over the past few years, I've been focused on COVID-19, and I look at it from an autoimmune perspective. And in that time, I have had such an intensive learning curve about virology, immunology, that I can now apply the understanding to multiple other diseases. And this is where my interest in measles came from. When I saw the outbreak of measles that was happening in the US recently, I thought, what is going on? Why are you seeing so much spread of measles in multiple parts of the USA? So it wasn't simply that the unvaccinated children were passing it on to each other. That's possible. But my bigger concern is whether or not this is part of a much bigger subclinical outbreak connected to COVID. So, this is where I've been focused for some period of time. And if you're interested in seeing what I'm looking at, the unseen threat is measles about to intensify amid COVID. This is a presentation that I'm doing next week. Sadly, I've had to rearrange the time, but I'll be presenting it next week for all those who want to see. Go in the description below, and I'll be able to be probably a bit more candid about what I think and see. But today's focus is going to be primarily around what Dr. Pierre Kory had said on the Children's Health Defense. And I thought I'd capture this bit from him because it reflects an important principle about how we should be looking at managing measles properly in the future. For those who don't know him, Dr. Pierre Kory has had a lot of critics and a lot of support. He was the founder of FLCCC, and this is his CV that I'd collected some time ago. And he was involved in the math protocol, IMAS prophylaxis. So they were involved in early treatment. And he was one of the people who was promoting the use of rhymes with pectin. He was previously critical care specialist in terms of chest diseases as well, world pioneer in the use of ultrasound in the diagnosis of critically ill patients. And because of those views and what he had done and what he was saying with regards to rhymes with pectin, he ended up getting delicensed from his with regards to his ability to practice medicine. If there's one thing that I would advise is that he clearly is an outspoken person. He's done a lot of research. He has done a lot of work around COVID. His interventions have brought benefit, it seems, to many people. And if you delicense him, what you then do is you take away his incentive to be nice to you, if that makes any sense. Because very often, from a clinical perspective, we are very aware of the challenges that clinicians have. And so there's a professional courtesy with regards to how we would approach and look at things. And when they have taken away his license, suddenly he doesn't need to be nice. He can just say it as it is. And so, therefore, what we're seeing here is him just being straight to the point. Important to note, I'm going to pause it at some points because I don't necessarily fully agree with everything he says, but there are a number of points that he raises that fits quite nicely into the presentation that I'll be going to be doing shortly. So let's just listen to what he had to say. And as I said, he was on, I'll show you this here, he's on Children's Health Defense. Now, remember that this is also connected with the fact that they are not so pro vaccine. And so, therefore, take that as you can and as you wish. Let's hear what he had to say.
This case was tragic and really had nothing, I shouldn't say nothing to do with measles, but she did not die of measles by any stretch of the imagination. In fact, she died of a pneumonia, but it gets worse than that because she didn't really die of the pneumonia. She died of a medical error.
Pausing here a minute. So, the first thing I'd like to say is that this is the first point that I have to say I don't necessarily agree with, is that I do think she died related to measles. I'm not sure if it's necessarily fair to say that she had measles. She most likely had a measles pneumonitis, which I'll explain in more detail in the presentation. And in that pneumonitis, she would then have had a secondary bacterial infection. But to say that it's not measles, I'm not sure if I agree, but I understand where he's coming from when he's talking about the fact that she died primarily of a pneumonia. Because you have to remember the child involved here was healthy without any known comorbidities. And so you would expect that they should be able to respond to antibiotics in a secondary bacterial pneumonia if it was used appropriately. I think this is more likely to be what he was getting at when he was talking about it. Let's continue to listen.
And that error was a completely inappropriate antibiotic. It was an insufficient antibiotic. When you admit someone to the hospital for pneumonia, what you need to do is you treat what's called empirically, meaning you put them on antibiotics that you think will cover the most common organism. And that's why this case is absolutely enraging. It's infuriating because she died because she got an inappropriate antibiotic.
So pause here again, and this is an important point. And many people don't quite understand this. This is how it works as well in terms of COVID, and it's a critical point. When you're talking about sepsis, say bacterial sepsis, we know that timing is absolutely critical, meaning that if you let sepsis run away, that someone doesn't get the antibiotics as quickly as you can, doesn't get the fluids, you don't monitor the vitals and so on, that patient can deteriorate very quickly, even if you use antibiotics. And I apply this in the same way with COVID. If you delay with the initiation of steroids, so meaning that the longer it takes to use it, the less likely it is to be beneficial. And that was most aptly shown by Dr. Shetty, where as soon as patients started to deteriorate, he got right in. And it's the same rule that would apply with antibiotics. And I think that's what he is highlighting there.
I mean, this is like medicine 101. You put them on 2 antibiotics to cover all the possibilities. It's a really, it's a grievous error. And it's an error which led to her death. Not only did you have several days delay of decline without the appropriate antibiotic, but then when they realized that they were missing the appropriate antibiotic, it took them, as far as I can tell, 10 hours to administer it. And by that time, she was already on a ventilator. And approximately 24 hours later, actually less than 24 hours later, she died. And she died rather catastrophically.
So again, pausing you here. Now, part of the problem, as I said, is that this is an area that he is well versed in. So he's got awards. He's worked for most of his career in critical care. He knows exactly how this works. He can imagine seeing the patient, the timing of how it was managed. And in that case, this is why I'm saying he's not holding back. He's highlighting that I don't know the details, but he is indicating from some of the information he probably has that it took them 10 hours to administer what would be the appropriate antibiotic. That's absolutely critical. And he's right. If you wait that long and a child or anyone has sepsis, you significantly reduce the chances that you're going to have a good outcome. So that's an important point that he's raising.
As she was declining, she was in a state of what's called shock, and she needed medicines to maintain her blood pressure. And suddenly her blood pressures crashed and she arrested. And that kind of suddenness in an infection suggests some other cardiac event. And in a child like that, with that amount of inflammation, infection, and disturbances in the bloodstream, I can only surmise that she died of a catastrophic pulmonary embolus. It's disturbing when
So again, I'll pause you here. I understand where he's going with that. And I would have presumed that they would have been able to identify that, hopefully, if the patient was going to die of a pulmonary embolus. That's where there's a big clot, usually coming from, say, the legs going into the lungs, the big arteries, and then blocking the blood vessels there. And so people can die quite suddenly. I think the only proviso I would say is that if she already had sepsis, required antibiotics, was dropping her blood pressure, that would suggest that she was probably having septic shock rather than a pulmonary embolus, and she just deteriorated. Children, they can deteriorate extremely quickly when they get unwell. And so it's likely, more likely, that that could be the cause. By now, I would have assumed that a post-mortem would have been done and they would know all the details. So I would be very surprised if it turned out to be a pulmonary embolus. But I can't discount the idea completely because it could also present in almost exactly the same way. Let's hear what he has to say at the end.
I review the chart because I'm seeing that she's missing a really critical antibiotic that would have turned her around. I believe that with high confidence. This was an otherwise healthy child, as I understand, who came in with a common pneumonia, and a routine appropriate antibiotic would have, I believe, changed that trajectory from what it unfortunately and tragically became.
So yes, as I said, there is that that is his opinion on it, and at the moment, without the details, it's very difficult to discount. Um, However, and this is where I think it's important, there are a few things in this that I think are really critical, and it's only when you take a deep dive, because I never really thought to look at measles before. It was only because of what I was noticing coming across the US, and I realized that the spread seems to be higher than I would have anticipated. And therefore, whenever I see that kind of pattern, I always look at the potential link with regards to COVID. And I think that what we're seeing is a general, broad population immunosuppression. And this is allowing more viruses to circulate. So it's not just measles, it will be RSV, some bacteria, mycoplasma, streptococcus. And so, therefore, if there are children who are unvaccinated, they are at higher risk. And so, this is one of those very important times where I actually think, because of what happens with measles and because of the risk of pneumonitis in measles, even if someone was extremely against the MMR vaccine, if that's the case, at minimum, get the single measles vaccine, because what you don't want is that it seems as though it's a very high exposure environment, and it may not be worth the risk for children to be exposed to measles if there are underlying issues that maybe can put them at risk. Here is one very interesting point that I'll use just as I finish off here, that when I looked at this, I thought this was very fascinating. Measles has a different entry and exit route. And this slide here shows you the measles virus here. And when it's exiting, it goes from the basolateral part of the cell. So it means it gets from the bloodstream inside the epithelial cell and then spreads. Now, what that means is that the virus here can't reinfect these cells. The infection comes from the bloodstream because the virus has already circulated in the blood. And so then this virus is then being released from the epithelial cells in the airway tracts. That's important because, in my view, when people talk about a measles pneumonitis, the fact that the virus can't really reinfect these cells, and it doesn't actually necessarily do a lot of damage to the cell, in my view, it suggests that there is likely to be another mechanism at play that could lead to the pneumonitis. That's part of what I plan to cover in that presentation. So if you're interested, make sure you look in the description to get the link for that. But it highlights a critical point. We are now likely to be seeing multiple diseases, viral infections and some bacterial infections, circulating at levels that we had not seen before. I think that it represents a significant population immune suppression. The big concern is that if you are having subclinical measles circulation as well in the vaccinated cohort, which is about 92 to 94%, depending on where you are, it will also potentially worsen the immune suppression, because measles is one of those viruses similar to COVID that wipes the immune memory. You cannot have both viruses spreading across the population at the same time and not expect to find very serious problems in the near future. So that's really where my focus is. And that's really why I think that this is such an important discussion for us to have. So please think about joining me on that presentation, and we'll continue to keep you updated on the science.